Season approaches, it is important to focus on preparedness, prevention before the peak hits. And joining us right now to talk more about that is Dr. Riddhi Bowry. She's from Jupiter Medical Center. She works in the ER there, and we were talking about flu season. This time of year, what kind of people are coming in? Do they have, is it sniffles, cough, congestion? What are some of the symptoms?
It's back to school season, so we are seeing an increase in the sniffles and the coughs as the kids go back to school. Super important to get vaccinated now as opposed to later because it allows the body to build immunity before the peak of flu season.
Talk about the flu vaccine itself. I know there's always this, controversy around vaccines. The flu shot is a little different than what we've seen in COVID shots and things like that, correct?
Right. Yes, the flu shot's been around for a long time. It's safe. It reflects the strains this year of the strains before. It's widely available. It's easy to take. If you're afraid of needles, there is a nasal spray version now. It's for certain populations, especially children. So it's easy and very effective, and we highly recommend it.
Who do you recommend get this shot, this vaccine?
Especially vulnerable populations, so kids, the elderly, anyone with chronic conditions that could increase their complications from the flu should get this shot.
You know what, there's a lot of other symptoms that go along with the flu. How does someone know when they have the flu versus maybe when they go in and just have maybe a cold or something like that? How does a person know?
Well, the best way to know is to get tested. There are swabs that we can do to test to confirm it, but the initial symptoms are very similar. The flu definitely is more severe. So if your symptoms have been going on for more than a couple of days, your fevers are not breaking, the cough's not getting better, then get tested to confirm it. There is an antiviral as well available to take for certain populations. So the sooner we know, the sooner we can start those treatments.
A lot of people will maybe go to their primary care physician, but at what stage should somebody really think about going to an ER?
If you're short of breath, if you're starting to become confused, or if you notice your family member is getting lethargic, if they are not getting better, they're only getting worse despite everything you've tried at home, bring them to the ER, we'll figure it out and take it from there.
Are there other treatments available beyond the vaccine treatments and different medications that people can take, let's say if they do get the flu?
Yes, so there is a medication, the antiviral I was referring to earlier is called Tamiflu. Again, it's for certain populations only. It will reduce how long you have the flu and its symptoms. There are general medications, take vitamin C supplements if you're having any flu-like illness, eat healthy, exercise, drink a lot of water. Fluids are great, just to help your body fight whatever virus it is, but especially the flu virus.
Speaking of that, what are some of the tips you have to help us maybe boost our immune system and maybe prevent from getting the flu altogether, which would be optimum, right?
That would be optimum. The best thing you can do is wash your hands frequently. We know there's going to be a peak in the season in a couple of months. Wash your hands frequently, wash with soap and water ideally for 20 seconds, especially with children. The happy birthday song is a great time frame to use that. If not, use an alcohol-based sanitizer. Disinfect all the surfaces that you come in contact with, especially the ones you touch more frequently. Do not touch your hands to your eyes and your ears and your face. That's how viruses get into your system. If you're coughing, cough into your elbow. Don't cough into your hands or cough into a towel or a handkerchief or a tissue, but don't cough into your hands directly. Mm-hmm. And lastly, maintain distance from people who appear to be sick to you. That way you're not in close proximity to get the virus.
The virus. All right. Dr. Bowry, thank you so much for coming in.
My pleasure.
I'd rather see you here instead of in an ER, but you're at Jupiter Medical Center, and we appreciate your time today.
Thank you so much.
All right.
I appreciate it.
Have a good one. We'll be right back with much more news.